Hi, I'm Dr. Brian Kaufman, a retired family doctor and a CLL patient myself, and the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. And I'm going to be presenting some of the most important and interesting papers that were presented at the American Society of Hematology, or ASH's, annual meeting in 2024 in San Diego, California. And the paper that I'm going to be presenting next is disturbing in its impact for patients. Its title is Real-World Analysis of Insurers' Rejection Rates for Specialty Oral Anti-Cancer Prescriptions in Nationwide Samples of Patients with Blood Cancer. So while this isn't specific to CLL, it is certainly relevant to CLL. And here's the bottom line. When this analysis was done in 2022, a full 1 out of every 4 new prescriptions for specialty oral cancer medications were rejected by insurance. And here's the breakdown. Almost 4 out of 10 commercial insurance drugs were rejected, 39%. In Medicare, it was much better, only 16%, and in Medicaid, 30%. This research was presented by Dr. Doshi, a PhD at the University of Pennsylvania, on behalf of her colleagues, and she gave one of the prestigious oral presentations at ASH's annual meeting in 2024. Let's go into the background a little bit. Specialty oral anti-cancer medications have drastically improved outcomes for leukemia, lymphomas, and myelomas, including chronic lymphocytic leukemia and small lymphocytic lymphoma, CLL/SLL. But it comes at a considerable cost, and not all patients have access to them. These medications are often very expensive, and many are taken for extended periods. Some are taken until the patient can no longer tolerate them or until the disease progresses, which can be years. To control the high cost, insurers have restricted formulary coverage. In other words, they're denying access because it's not on their formulary, or they've instituted laborious and strict prior authorization procedures or step therapy policies where patients have to fail one therapy before they can get to the next that can delay the start of treatment or even change what the treatment plan is. The real-world magnitude of prescription rejections overall and by insurance type is largely unstudied from the patient's perspective. So how was this study done? It was a nationwide, real-world retrospective analysis. Prescriptions and medical claims from Symphony Health System integrated database were used. Data included whether a prescription was approved or rejected by the patient's insurer and the reason for the rejection. Any patient with 1 or more prescriptions for any blood cancer in 2022 were included. Data was compared for brand names and generic medications. So let's take a look at the results. There's a lot of data here. Almost 16,000 patients were studied. The average age was a little over 65. 54.7% were male, 54.8% were white. 58.2%, 36.1%, and 5.8% were enrolled in, respectively, Medicare, commercial insurance, and Medicaid. So let me say that again. Almost 6 out of 10 were in Medicare, a little over a third were in commercial insurance, and 5.8% were in Medicaid. The initial rejection rate overall, combining all the data, was 25.7% among the 9,272 patients prescribed brand name only, no generic equivalent medications. Still, there was a significant variation rate in the rejections based on insurance type, with commercial insurance having more than double the rate of rejections compared to Medicare. So to recap what those rejection rates were, for Medicare, 16%. For Medicaid, 29.9%. For commercial insurance, 39%. 3 out of 10 rejections were due to needing a prior authorization or step care, in other words, having to try a different medication first. 1 out of 8 was because the drug wasn't on the formulary. So most of the time it wasn't that the drug wasn't, quote, available. The drug was still available, but there was these roadblocks that were put in the way for the patients to get it. Prior authorization and step care was more commonly the reason for rejections with Medicare patients. Commercial patients were more likely to have a lack of formulary coverage as their reasons for rejections. Compared to those insured with Medicare, those with commercial insurance had 3 times the rate of rejections, and those with Medicaid had 2 times the rate of rejections. Less than 10% of the rejected prescriptions were eventually approved within 3 months for all insurance types. 6,570 patients were prescribed an oral cancer medication where a generic option was available. Remarkably, rejection rates were even higher and nearly identical between the brand names and generics. The initial rejection rate for brand name medications was 34.2%, and for the generic, it was 35.3%. Medicare patients had by far the lowest rates of rejection. Only 1 in 4 initially rejected prescriptions were eventually approved within 3 months, regardless of insurance types. So, what are our conclusions? Somewhere between 1 in 4 and 1 in 3 specialty oral cancer prescriptions are initially rejected. Even when adjusting for socioeconomic determinants of health and clinical markers and status, the rejection risk was higher in those with commercial insurance, followed by Medicaid. Medicare had by far the lowest rejection rate. Generic drugs didn't fare any better. The vast majority of scripts initially rejected were not approved within the next 90 days. The reason for the high rates of rejection and the discrepancies in the rates, especially the high rates for those with commercial insurance, needs to be investigated and remedied. Patients are too often being denied life-saving or life-extending medications. This doesn't even address the likely reality that many prescribers aren't even bothering to write scripts for these newer revolutionary drugs, as they know from experience the high risk of it being denied and the psychological toll that will take on their patient. Doctor, you prescribed this medicine, it's your first choice for me, and I can't get it, what's going on? Patients rightly ask why their first choice medication my doctor wants, they can't have. It also makes a lot more work for the doctors, which they're not very keen on. CLL Society has and will always advocate for improved access to all therapies for all CLL/SL patients, regardless of insurance or socioeconomic status. One example of our efforts is highlighted in an article on the website that I provide a link to. If you want to read more details of this stressful and concerning situation, the original ASH abstract, real-world analysis of insurers' rejection rates for specialty oral anti-cancer prescriptions and a nationwide sample of patients with blood cancer, is linked on our website. Thank you for your attention.